I'm Carolyn Edwards Golden, president of the Arc of Greater Columbus, and we're here today to interview Carolyn Evans. I met Carolyn one day and I was talking to her about fetal alcohol spectrum disorder prevention project, and she asked me what it was, and I told her it's about making women aware that when they're pregnant they shouldn't drink alcohol. And at this time she let me know that she has had that experience in her past as a woman who abused drugs and who now has children who she feels have been affected by the drug abuse. And at this time I'm gonna introduce you to Carolyn and let her speak to you about her experience abusing drugs and what she thinks the effects have been on her children.
Thank you. And of course you are definitely correct. You know, I have a 18-year-old son now. I had that child when I was in the middle, I would say the midst of active addiction. I am currently a recovering addict. I do have 18 years clean, so I've been clean ever since he's been here, but I used up until the time that he came out of me. So we have a saying in the fellowship that I attend, the recovery fellowship, that says that he's the child that didn't have a choice in the matter. You know, so he's the one that everything that I used went to him, because when we're pregnant, that's how we feed our children. What I eat, he eat. What I drink, he drink. You know, what I smoke, he smoke. You know, and I can tell now, even though he was never diagnosed with anything, you know, by any doctors as having any kind of physical limitations or mental limitations that they could find in him, I see, you know, some of the damages that child still has to face. You know, his emotions, you know, his decision making, you know, his inability to have good social interaction with others. You know, he has problems, you know, with his choosing peers, you know, that are, you know, good productive children that are doing something with their life. He's not attracted to that kind of stuff, you know. So you know, I see these limitations in him, and I know that, you know, for many years I had to go through the struggle of blaming myself, you know, when I see my child suffering. You know, because you got a choice. You can either learn to live with the disease of addiction, which when you are using during your pregnancy, your child has the disease of addiction and you gave it to him or her. You know, so when they got two choices, they can learn to live with the disease of addiction, you know, which I have through some coping skills and recovery programs, you know, and different outlets, you know, out here, you know, because we have to seek outside help. You know, get you a psychiatrist if you need one, get you some medication if you need it. You know, they got many recovery programs available for us, but a lot of times children won't reach out for these things, so they're gonna suffer with the disease of addiction because they have a hard time learning how to live with it. You know, and me, I'm the only example my child has. You know, and of course, being a teenager or even being a young child, because he started his developmental I say sabotage of his own life. He started that probably by the age of 11. So of course, you know, around by that time he's not gonna come to me because I'm the problem, you know, because the first thing kids want to do is blame the parents, you know. So it's been a hard-won struggle, you know. The only thing that I would suggest any person that plans, if you plan on having a child or you're getting pregnant by mistake, you know, because I wasn't expecting this last child, you know, but know that life that you carry inside of you is dependent on the decisions that you making in your own life.
Absolutely.
That child is dependent on that.
Absolutely.
So when we make these destructive decisions, don't think that you're just harming yourself or that this is just a good time, part of time, you know, a time to be caught up in the grip, because you that child that doesn't have a choice in the matter, you know, it's some consequences to that.
Yes.
It's some big consequences to that.
Yes.
So, you know, it's a hard road to toe.
So Carolyn, what age were you when you got pregnant?
I actually got pregnant late for the second time. You know, I also told you I was a teenage parent.
Yeah.
You know, I had my very first child at the age of 14. You know, and that's a whole nother issue. You know, that we need to be aware of, that it's not a good thing to do.
But during this time, no one talked to you about fetal alcohol syndrome. Even when you went to the doctor, no clinic, no doctor, nobody mentioned to you that you might be harming your child.
If they did, it was such a glossing over with minimum concern conversation that I glossed over it with minimum concern. You know, there was no sternness, there was no this, that, and the other's gonna happen, you know, because at 35 years old, their main concern with me was that I may have a child that at my age, not because of the abuse, but because of my age, that my child may have Down syndrome. You know, but there was nothing that would put a fear in a person. You know, like the doctors are not gonna say, well, you know, let me show you some pictures of children, you know, that suffer from being born addicted to drugs. You know, let's watch this film first. You know, or anything like that. There was no shadowing of me leaving out of the doctor's office and thinking, well, maybe I should.
Now, do you think if somebody had told you what you know now, would it have made a difference in your behavior as far as the drug abuse? Would you have listened?
I think that because I was concerned, because you know, when you're not doing the right thing anyway, and you know what is right, you always feel some type of guilt anyway. You know, I think that it depends on the person. If the person would have been able to tell me, you know, their experience with that, or if the person had been able to show me, you know, like I said, you know, visual things really help a lot of people. You know, if we throw a big picture of the addicted baby, you know, in your face, or show you, you know, exactly what it is that this is what you're capable of bringing here. You know, take them to the hospitals, let them visit those centers, you know, where children are being left there because, you know, people don't want to adopt drug addicted babies.
Right.
You know, let them see just how many this number is, and say, you know, if somebody had said to me, your child gonna be just like this, I think that would have scared me. I think that would have helped me make a decision, even though it's really hard to make that decision to stop using drugs. I think it would have helped me to get on that path a little bit faster, you know. But these days I think that our intervention has to be more right. You know, we need to start with the school. We need to start in school. We need to start in elementary school. You know what I'm saying? You know, that's exactly where it needs to start, because we need to grow up with the information. Because if we don't grow up with this information, the information that we're growing up with is information that we're getting out here.
Right.
You know, which is everybody having sex. You need to be having sex too. You know, having babies is cool. It's just like having your own live baby doll. You know, all kind of little stupid lies that don't have anything to do with what's really going to happen to you when this baby's born.
Absolutely. Absolutely. Folks, this is Carolyn Evans. She lives in our neighborhood. She is a live experience of a mom who abused alcohol, other drugs, and who had a child who she suspects is now living with the effects of her alcohol abuse. Carolyn, I certainly do thank you for talking to us today and being so transparent. that this is real.
Yes.
And hear from someone close to them how it has affected their lives. And so, folks, pay attention. She's real. Hey, this is the Ark of Greater Columbus reporting, and I'll see you next time.